In this video, we're talking about IPL and dry eyes. So what is IPL and how does it help? So hi, my name is Felix. I'm an optometrist working at Ezekiel in Perth. IPL uses like a intense light that happens only every few seconds, targeting the gland sitting on your upper eyelid and lower eyelid. So it applies heat on the gland itself. So any blockage can be released and make the palm work more efficiently and effectively. Secondly, all the redness that we can see on your lower and upper eyelid is actually due to inflammation of the glands and the surrounding area as well. It could be from bacteria, could be debris, could be gunk, could be like dead skins. So the other benefit of the IPL is just to unblock all that blocked blood vessels, and then helping to clear up any redness or dilated blood vessels that are sitting on your eyelids. So once the glands are unblocked, and then we also improve the blood flows along your eyelids. In theory, your dry eye will improve, especially it's gonna improve the amount of excretion from the glands, improving that lipid layer on the front of the eyes. It's gonna improve your evaporation time, and your eyes will better and look better as well. So laser is more powerful than the IPL. Laser tend to select a specific wavelength of light, and by selecting the specific wavelength of light, the energy is much more stronger, targeting specific layer of the skin. IPL, however, uses like a broad spectrum of wavelength, varying from 400 nanometers to 1200 nanometers. So the energy released by the IPL is a bit more weaker, and it's spread across all different layers of the skin, so it's quite safe. There is a condition called Rosacea, which is like a common chronic skin condition, manifesting as a facial redness or redness on the eye and lumps and bumps on the skin. Originally designed for dermatology, so the use of IPL was discovered in 2002 by accident actually. It was when Dr. Toyos in 2002 found that his patients who's been treated with the IPL for their acne and skin rosacea also mentioned that their eyes were feeling better. So upon further examination, he found out that the IPL actually treats the myopomian gland dysfunction and treats the dry eye disease, which led to the current treatment protocol. That's saying that so since then the application of the IPL has been part of the dry eye disease treatment by unblocking the myopomian glands. Patients are telling me that once we apply the IPL, it feels like a small heat that they can feel on the skin. So when we apply the IPL, it treats the eyelid, but it also treats the skin surrounding your cheekbone and your noses as well. So once you apply the IPL, more patients are telling me that they can feel that heat sensation on their skins, having a rubber band snap on your skin, that kind of sensation. So, but otherwise most patients are okay. It's just a short-term heat sensation that they have on the eye. After IPL, the skin might feel a bit more sensitive for about 48 hours. During that time, we do recommend that you stay away from direct sunlight, and if you do have to go out, make sure you apply a good amount of sunscreen. And some patients we do recommend that put a moisturizer cream on the skin after we apply the IPL. After IPL, you can definitely go back to work and drive to work. It's currently not covered under Medicare or private health insurance. So most patients report improvement of their symptoms after the first or the second treatment, but evidence-based study reporting that the patients do require a minimum of 3 to 4 IPL sessions to get the optimal result. The appointment for the IPL usually take about 40 minutes. The actual IPL itself only take about 5 to 10 minutes. But after we apply the IPL, we do a bit more vigorous eye examination, a bit more testing. So we do like to express the glands manually and we also want to make sure that your eyelashes and eyelids are clean, and we also want to make sure that the eyes are comfortable before you leave our practice. Yes, you still have to use eye drops to begin with. So typically you may have to use eye drops for up to 12 weeks, but during that time you will find that you're gonna be using eye drops or lubrication eye drops less and less often as the outcome of the IPL get better with the number of treatments. So it gets progressively improve the eye, and so you're gonna be like using the eye drops less and less often. Call us on 089386 3620 to discuss effective, drug-free, drop-free treatment options for your dry eyes. Feel free to make a comment or type your questions underneath this video. Thanks for watching, and I look forward to meeting you soon.